الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Maternal and Child Health Services 2 or Preventive Services for Mother and Child. First we will talk, the first 3 lectures will be about mother by Professor Mh2 Suleiman. Antenatal advice. During pregnancy, mother is very receptive. She constitutes a captive audience, thus health education is effective. She is advised on the following topics: on nutrition, no restrictions in the diet if she is a normal case. Balanced diet should provide 2,200 kilocalories per day. No food or fruit is abortifacient, should consume more of green leafy vegetables, should avoid spicy foods because of physiological acidity during pregnancy, should gain weight at rate of 1.5 kilogram per month as to get 3 kilogram newborn baby. Antenatal advice continued. On personal hygiene, daily bath, not to be very particular about nipples. Oral hygiene to be maintained, should wear clean, light and loose clothes. On rest and sleep, 2 hours after lunch, 8 hours during night. Antenatal advice continued. On exercise, light household work can be done. Walking in morning and evening is preferred. Excessive physical labor to be avoided. Dance therapy, simple, graceful, smooth dance movements inspires emotion, reduces stress, keeps body supple, lowers serum cholesterol level, makes woman more cheerful, avoids depression, strengthens body muscles, relaxes mind, and therapy facilitates smooth and easy labor. It is recommended during second trimester only. Antenatal exercises are shown in picture which will come later. Antenatal advice continued. On drugs, she should not take any drugs without consulting the physician. Doctors should not prescribe tetracycline, steroids, LSD, streptomycin, thalidomide, gastric irritants like Brufen, etc., because they affect fetal growth and development. X-rays to be avoided because of radiation hazards. On habits, alcohol and smoking are strictly prohibited because alcohol affects fetal growth and development, and smoking results in low birth weight newborn. Continued antenatal advice on sexual relation, restricted during last trimester, prohibited if there is history of miscarriage or premature delivery, can be indulged if position is comfortable and pressure-free. Continued antenatal advice on warning signs. Mother is advised to report if she develops one of the following symptoms or signs: bleeding per vagina, blurring of visions, convulsions, loss of fetal movement, severe headache or giddiness, any other unusual symptoms. What are the antenatal services? They are either nutritional services, immunization services, medicinal services, family welfare services, and educational services. Immunization services. Against tetanus, first dose of tetanus toxoid should be given to mother in first antenatal visit and second dose after 1 month. This is mainly to prevent neonatal tetanus. If she has conceived within 5 years of previous complete immunization, 1 booster dose of tetanus toxoid is enough. Suppose mother comes very late in pregnancy, at least 1 dose should be given. No pregnant mother should be deprived of at least 1 dose of tetanus toxoid. Continued immunization services. Immunization against erythroblastoma fetalis. If mother is Rh negative and fetus is Rh positive, give mother Rh anti-D immunoglobulin during 28th week and 34th week to prevent erythroblastosis fetalis, Rh incompatibility, which is characterized by congenital hemolytic anemia. If newborn is Rh positive, mother is given another dose soon after delivery. One dose should be given after abortion. Intrusion of Rh positive fetal red cells in maternal circulation of Rh negative mother provokes an immune response in her, leading to production of Rh antibodies, which can cross placenta, usually during labor or cesarean section or therapeutic abortion, and produce fetal hemolysis. Since isoimmunization occurs during labor, usually first child escapes from risk unless mother is already sensitized by Rh positive blood transfusion. Rh status of fetus can be detected by amniocentesis for presence of a pigment called bilirubin protein complex, which normally decreases as pregnancy advances and increase in case of erythroblastosis fetalis. Continued immunization services against German measles, rubella. Single dose of rubella vaccine has to be given to all potential mothers, but it should not be given to a mother during pregnancy because live vaccine is attenuated to maternal cells, not to fetal cells. So it may lead to congenital rubella if given to a pregnant mother. Thus, pregnancy is an absolute contraindication to German measles immunization. Continued immunization services for hepatitis B. If pregnant mother is hepatitis B surface antigen negative, give hepatitis B vaccine course. However, it will not provide immunity to newborn. If mother is hepatitis B surface antigen positive, hepatitis B vaccine should not be given to her because vaccine does not provide immunity in an already infected person carrier. Fetus gets infection from mother only perinatally at time of birth. So, since the incubation period of HB is long, from 50 to 150 days, active immunization given to newborn as a post-exposure prophylaxis with hepatitis B vaccine, starting first dose in 48 hours of birth with intramuscular hepatitis B immunoglobulin, one dose but on different sites. The dose of hepatitis B immunoglobulin is 0.05 to 0.07 milli per kilogram body weight. That's to say about 2 milli at birth, followed by rapid schedule for the vaccine. At 0, we talked about it. Then 1, 2, and 12 months each of dose of 10 mcg. Medicinal supplementation. First, IFA tablets, 100 mg of elemental iron and 500 micrograms of folic acid. This is prophylactic measure to prevent nutritional anemia. If the mother has visible signs of anemia, she is advised 2 tablets per day to control anemia. Antihelminthic drugs, mebendazole, should be given once during the second trimester to deworm hair. If VDRL test is positive, congenital syphilis prevented by giving long-acting penicillin if she is suffering from primary or secondary syphilis. Family welfare services. All this is during antenatal. If mother is primigravida, she is sensitized about different contraceptive methods, and if she wants to have a second child, she is motivated for spacing with an IUD after delivery. If she is second gravida, she is motivated for sterilization. Educational services as and when mother develops any health problem, she is educated about that to take treatment correctly and completely. She is also educated about art of child care. Prevention of mother to child transmission of HIV. We talked about it in HIV antenatal clinic. Antenatal clinic is where this is a description of the antenatal clinic. How you organize it. It is where expectant mothers are taken care of. Such clinics established in all subcenters, primary health centers, district and general hospitals. Clinics are conducted once in a week in subcenters and primary health centers and daily in general hospitals. Clinic in a subcenter has two rooms, reception room and exam room. Reception room where mother is registered, weight recorded and a card is prepared. This is with the nurse. Examination room where she is examined and delivery is being conducted with the physician. Functions of antenatal clinic: provide antenatal care for mothers, educate on mothercraft and child care, to detect high-risk mothers, to refer high-risk mothers to institutions. Mothercraft. Mothercraft equal art of child care. Special classes conducted in clinic by female health worker for all expectant mothers of her area, covering a population of about 3,000 from more or less 5 villages. Following topics taught. What are the topics to be taught at this about mothercraft? Physiology of pregnancy and childbirth, preparation for confinement, preparation for breastfeeding, preparation of baby clothes by demonstration of sewing and knitting, different family welfare methods. Mother is allowed to talk freely, so all her doubts cleared, so fear due to ignorance are removed, and an anxiety with delivery is decreased. She is educated about breastfeeding practices, as initiation of breastfeeding within half an hour of birth, feeding colostrum, avoiding pre-lactal feeds, exclusive breastfeeding up to 6 months, strict prohibition of bottle feeding. Risk approach. It is an approach toward antenatal mother to detect high-risk cases who are responsible for increased maternal morbidity and mortality. They require special nutritional care, supervision, and treatment. The high-risk cases are grouped into following 4 groups. First group: too young a mother, too old, too short, too obese, too many pregnancies, too frequent pregnancies, too prolonged pregnancy, toxemia, twins, triplets, and hydramnios, mother with malpresentation and malposition. This is the first group. The second group: those with previous reproductive wastage, abortion, stillbirths, neonatal deaths, and monsters. The third group: mothers with bad obstetric history, as instrumental delivery, cesarean section, prolonged third stage of labor, antepartum or postpartum hemorrhage. Fourth group: mothers with systemic disease, as diabetes, hypertension, liver disease, lung disease, renal disease, etc. Such high-risk mothers require meticulous antepartum care and institutional delivery. Thus, risk approach is a managerial tool to improve MCH care. 85% of expectant mothers will have normal delivery. 15% require institutional care, and only 5 out of 15 require cesarean section. Thus, pregnancy is a normal physiological process, but with a great pathological potential. Home visits. Home visiting by health worker female in rural areas is the backbone of all MCH services. Since most of deliveries take place at home, she should pay at least one home visit, even though mother is attending regularly the antenatal clinic. She should observe the environmental and social conditions of the home and prepare to receive the new guest. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.